For dry macular degeneration, there is no specific way of improving the vision in terms of drug therapy. However, we would first of all organise some form of low vision aids for the patients, so magnifying glasses. Secondly, to advise them as to how to look at objects. So for example, if you look straight at an object, the central part will be missing, and therefore when you're looking at something, say the television, you need to look to one side of the television. There are a number of computer-orientated aids to improving vision, which essentially produce magnified images which the patients can use for reading, looking at documents and so forth. There is also vitamin supplements, and although these do not necessarily improve the vision, there is some suggestion that they will stop the progress of the condition. The wet form of macular degeneration, in which there are new blood vessels underneath the retina, is now possible to treat with injections of drug into the eye. These drugs are designed to kill off the blood vessels, to stop the hemorrhage and reduce the amount of leakage of fluid underneath the retina, and hopefully prevent scarring and prevent ongoing damage. These have shown to be very effective in treating macular degeneration, and in 1/3 of patients we would expect the vision to improve, in 1/3 the vision to stabilise, and in 1/3 of patients, whatever you do, there may be some reduction in vision. What is clear, if you don't treat them, the vision will get worse, sometimes quite dramatically. Another important feature of treating, particularly people with dry macular degeneration, is to make sure that they have good lighting, for example when reading. So you need to have a good light behind you to illuminate the page and therefore help in improving the contrast of what's being looked at. I would also advise patients not to smoke, because that has also been shown to be a risk factor for the progression of macular degeneration.